Okay, this is the August 17th Incarceration Prevention and Reduction Task Force Behavioral Health Committee meeting, and we're meeting here at 9 o'clock. We have a quorum, and before we begin, I'd like to acknowledge that we are gathered on the traditional and unceded territory of Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us here together today. And please join us in uncovering such truths at any and all public events. And I'd like to call this meeting now to order. Okay, so the agenda just disappeared, but I think we're going to talk about committee priorities moving forward here. We've had this discussion now for I think the entirety of this year, and I just want to make sure that we're on point and looking forward with eyes wide open as we move into future agendas. And we also have a joint meeting coming up, I believe in September, with the Legal and Justice Committee. And I just want to hear from committee members what their priorities are. And so I'll just go ahead and open up to folks if they want to share at this point.
Dan, I can screen share the agenda and the current list of priorities, Ken, if you like.
I think that'd be helpful, just so we can all get back on the same page. I know we're all busy with other items and other professional agendas, so go ahead and share that, please.
Sure.
Thank you.
Just one moment.
Let's give folks a minute to take a look at the list here. Since we have, I see Ann Deacons on the call here, and that service capacity item O was, I think it scored the most, and it's clearly an issue with delivering the alternate response team for behavioral health calls. I'm wondering if Ann can speak briefly or not briefly, whatever, extemporaneously if you want to the Behavioral Health Administration Services Organization and Healthcare Authority to that item. Ann?
Good morning. I don't know that I have anything new to say. I think it is a statewide problem as well as a national issue. The state has hired somebody to address the issue specifically, but it is really a multi-year strategy because there aren't people entering the field in terms of colleges and universities either. So they're looking at wages, they're looking at incentivizing tuition and other ways to get people interested in the program. Locally, we're working with our providers, although all of them are suffering as well. So I don't know that I have any good news to offer. And the concern for us is always if we overload or overinvest in one part of our continuum of care, then the rest of the continuum gets off balance and then we don't really solve the problem. So for instance, if we put everything into crisis response, then all we do is continue to respond to the same people in crisis because we've got nothing to offer to stabilize them. So it's a huge challenge being talked about at every single meeting, and efforts are underway, but I don't see anything in the immediate future other than just people looking for work once they re-enter the workforce. I think we were hopeful with the COVID pandemic kind of stabilizing that maybe people would start back into the workforce. Obviously, the Delta variant surge has changed that and has delayed that.
Okay, there's a couple of items I want to unravel from your statements there. One is, are there other communities that are facing the same challenges in terms of trying to balance the crisis response? Bellingham's trying to do, Bellingham/Whatcom County are trying to do an ART, alternate response team. Are there other communities that you're aware of that are kind of in the same situation where they're trying to get something moving forward on behavioral health response, but at the same time trying to work with higher utilizers of systems? To your knowledge?
Our experience is that there's not a lot of programs that are focusing on long-term stabilization like our GRACE program. For instance, when some of us have contacted Eugene, Oregon, where they have the CAHOOTS program, one of their biggest concerns is that CAHOOTS just keeps responding to the same people in crisis because they don't have a GRACE program. So that's their concern. So to be honest with you, most communities are looking at crisis response. Very few have.
And you just went mute. You just got muted.
The cat muted me. Oh my God. Oh, sorry. Most communities don't have a GRACE program. And so they all complain about the fact that the same people keep getting responded to in crisis. That's what we're hearing. So obviously,
Okay.
when our community created GRACE, we did so after significant community input, and it was decided what we really need is this GRACE program to address the people that constantly call 911, whether it's law enforcement or EMS. And so, yeah, I think that's really the issue. We don't have a lot of GRACE programs that we're aware of.
Okay. I'm just going to ask one more question, then I'll open up for others. Do you think that the crisis response facility or center is being used adequately by law enforcement?
I don't know that I think I'd let Doug answer that maybe. I think that it's still a work in progress. The workforce shortage has certainly made it so that the mental health side of the house not all 16 beds are open. I do know they're getting law enforcement referrals and they're taking them. And I also know that we have a program advisory committee that has law enforcement representatives who are helping us create, a system whereby that crisis center is fully utilized to the extent possible. I think, the new legislation relative to law enforcement response and actions has kind of put some things on the side while we're trying to sort all that out. But I don't know, Doug, if you have more to offer.
Sure. I actually, after our last meeting, I checked with our field ops bureau chief about our utilization of the crisis stabilization center. And obviously, just because it was, the substance use disorder side was up and running before the mental health side. And I know they've had some staffing challenges. So we're not utilizing that a lot for diversion. It sounds like Bellingham has used that probably more than the county has. And I don't know if that's just because they were turned away, just because they didn't have room or the staffing to deal with it. But most of our diversion right now is being done via the LEAD program, or they're calling MCOT to come out into the field.
Okay. Others want to chime in on this topic? I can't.
Yeah.
I can only see a few faces, so just go ahead and pipe up.
I can second what Ann was sharing in terms of, and Doug, as far as the CSC, we continue to work really closely with the providers there, and they are typically at capacity for the detox side. There was some challenges in terms of equipment and also personnel, as Ann mentioned, on the mental health side, but we're continuing to work with that. And now it's coming down to available staff, qualified staff, to be able to provide services in terms of the mental health stabilization. Good communication with law enforcement, but obviously the recent legislation that's come up has really, brought some questions and needing some clarity in terms of not only transporting to the facility, but then if an individual had been admitted to the facility and there's challenges or problems with that person exceeding the level of care that they can provide, maybe behaviorally or otherwise, transporting that individual to a level of care, the hospital, that sort of thing can be a challenge as well. So the staff, the providers are concerned about that, but so far they've been able to manage that with a private ambulance company and or law enforcement. So I think that as we know a little bit more about the law enforcement's policies and procedures in terms of responding, which has really been in sort of development, I think that will reach that capacity. And oftentimes the reports that we're getting in the advisory committee is that both sides in terms of the providers, as Ann had mentioned, it's down some for the mental health side, but that's a personnel issue as opposed to a capacity, but they are at capacity oftentimes.
Okay. I can't see everyone on the call here. Is there a BPD represented here on the call today?
Sorry, Dan, that was Perry Mowry.
No, I know Perry. I'm just saying, is there Bellingham Police Department represented on the call today?
There is not.
Okay. All right. That's a gap. I really want to understand the Bellingham's use of that facility, as well as the county and the small cities. Ann or Perry or Under Sheriff Chadwick, can you remind me of the ITA status of that facility?
Two things. First of all, Dan, we have regular monthly reports on referrals and admissions to the facility, and we will send those to Jill to distribute, because that also tells how many law enforcement referrals were made. And then in terms of ITA, that the Crisis Stabilization Center is not what is classified as an evaluation and treatment center, which is what can provide treatment to people who have been involuntarily committed. However, they can certainly hold someone there who may be evaluated on site and meets criteria for evaluation and treatment through that involuntary commitment law. They can hold them long enough to get them transported to the appropriate facility. But it was never a civil commitment program. In terms of the criminal statute that allows for involuntary holds, not involuntary treatment, but involuntary holds, that is also kind of on a back burner for two reasons. One is staffing, but the other is sorting out the new laws and whether or not law enforcement feels or believes they can take someone there and hold them against their will for up to 12 hours. I think that kind of got thrown into the mix of this new legislation.
I'd just like to add to that. My understanding is, obviously the facility is, it's a voluntary facility. And Dan, I would follow up with Bellingham, but my understanding of my conversations with why we're not using it, one, just the capacity and whether that's the rooms are full or they don't have enough staff to take more people in. But it sounds like the city is bringing people from base camp to there that may benefit from that. And that's why that was able to, that filled up so quickly. And then I think we anticipated that may be the case.
Okay. Yeah. It's slightly beyond frustrating that we have these two animating issues that keep coming up. The one is the new one, which is the state laws that are coming through and being interpreted in the ways that they're being interpreted. And then the other is the workforce capacity issue. I mean, to me, money should never stand in the way of doing what we need to do, but getting people to take a job that is crisis oriented or working with people who are in crisis is it's challenging. I get that. I understand it. It's a long-term pipeline issue of getting people to go into the programs to get educated and then get some experience, and then do the work out there. But these things keep coming up over and over again. The laws, we talked about this in steering about not belaboring the frustrating nature of the laws, but they keep coming up, and I'm just trying to get my head around how to deal with that piece, and then the workforce piece. And anecdotally, my understanding is that BPD does not use the crisis response or a crisis facility to the degree that it could be using it. I don't know if that's true or not, but I want to get to the bottom of that and make sure that when we make these investments that the task force, one of the main pieces that we started with was that crisis facility over in Iron Gate. That was one of the big things that we worked on. And if it's not being fully utilized, or it's understaffed, or if there's missing components of it, then I think that it's got to be addressed. I don't know if we're the body to do that, but this behavioral health committee certainly discusses that item. So I just wanted to put that out there, and if folks want to respond, then go ahead, Ann.
I don't want you to think it's not being addressed. It's being addressed pretty aggressively, both regionally as well as statewide, as well as locally, in terms of the people that are part of the solution are law enforcement. Both sheriff's office and BPD are on that committee. I just don't think that you're going to see the timely solutions that we all hope for because of these other issues. But I don't want you to think it's not being addressed, and it's not just sitting. I mean, it's being discussed. We have things in contract or in lease agreements that push for it. We put a lot of pressure where we can, and try to incentivize where we can. So I know that doesn't help because we don't have what we want right now, but I do believe we'll get there. I just think we are in a crisis mode because of COVID and the impacts it has had down the line relative to workforce. That's part of our problem, but it's all being addressed, and the provider of mental health services, Compass Health, is well aware of the long-term expectation that an involuntary treatment certification will be part of that lease agreement.
Do you know what the time frame on that is, Ann? In the perfect world?
In the perfect world, maybe January of 2023. I think it's, yeah. Like, I don't have a crystal ball, but I can't imagine that. I feel like, how these things ebb and flow. I think we're at the lowest low right now. And for me, I think there's no place else to go but up. Perhaps I'm optimistic too much, but I don't think so.
Okay, sure feels like it. Okay, others want to chime in on this one? And I can only see like 4 faces, so if you want to talk, go ahead. Okay, seeing none. All right, we've got about 9 minutes until Heather's going to join us. If she doesn't get here right at 9:30, I'm going to go into the ARPA piece so we can just keep this thing moving. We've got some other beyond service capacity. We have the racial equity. That should be item N should be racial equity, not racial equality. But anyway, we had the GARE representative present to the steering committee, and a lot of really good discussion on that. I want to make sure that we're that we're applying the racial equity lens to the work that we do on every item. And so I will endeavor to make sure that that's in play. And if folks will recall, it really comes down to there's a 6-step process for GARE, and it's fairly simple and straightforward. So I just I want to make sure that we incorporate that into the work that we're doing. Moving on to item G, juvenile SUD. If Chris Cochran is on the call, go ahead, Stephen. You have a question?
Dan, I just wanted to say it seems appropriate that the discussion about these priorities ought to be filtered through that racial equity toolkit. And
Yeah.
the beginning point in my mind with that is looking at whatever data we have on the racial composition of who would be affected by these priorities. That would be a weighting factor, it seems to me. I don't know how we'd get that data, but I'll just throw that thought out there.
Yeah, so right, exactly. Good point, Stephen. I think on the Crisis Stabilization Center, I think that the data pieces, I don't know who collects that, and if they collect racial and ethnic data, but that's got to be part of the discussion. Same goes for the AR. Well, I don't know how this is going to work with the ART, but it would be helpful to have that. Same for LEAD and same for GRACE, and pulling those data pieces in would be super helpful. So I think in further discussions on those items that's got to be a part of it. Okay, I want to keep us moving here on juvenile SUD, that's substance use disorder. Chris Cochran is going to be providing a presentation at a future behavioral health committee meeting. This speaks to the upstream work that we've been trying to accomplish. Chris, I don't know if you're on the call. I can't see you, but if you want to just chime in briefly on that and let us know what you're going to talk about.
Chris is not with us today.
Okay, all right. So that'll happen. Jill, our joint meeting with Legal and Justice is in September. Is that correct?
Correct.
So that's next meeting. I'm just trying to figure out if we should have that presentation at that meeting, or if that should be just held for behavioral health committee only in the October meeting. So I don't know if folks have an opinion on that. I'd love to hear it. Otherwise, Parker and I will try to decide that one.
It seems to me, Dan, that a lot of times juveniles are involved in SUD services, whether it's assessment or what have you, oftentimes in connection to some situation that is judicially involved. Not always, but oftentimes that's sort of the compelling factor. The other one obviously is involvement in school, which is obviously not judicial, but I think that there might be some merit to having that discussion in the combined meeting. So that's just one thought.
Okay, I'm willing to have that discussion. If Stephen, I think you're probably the best arbitrator on the joint meetings. Do you have an opinion on that?
I certainly can see the value of it in the joint meeting. I think that in addition to your consulting Mike, I would just suggest you, Raylene, Arlene, and Mike reach some conclusion on that. Like I said, I think it would be appropriate if you wanted to.
Okay, duly noted, as the lawyers say. Okay, yeah, I think it's to me. I'd like to get Legal and Justice opinion on how the new laws are affecting any of this stuff when it comes to juvenile SUD. My understanding is that juveniles do not have, with Blake decision, they don't have access to carry drugs in their possession willfully or unknowingly or whatever. But so I just want to understand that piece, and this speaks to preventing people from getting justice involved later when they're adults. Okay, folks, do you want to any other opinions on the next items here before we move off into the ARPA discussion? crisis response, reentry, and warm handoff meth use, further upstream prevention. Anyone want to chime in, Undersheriff?
I did want to just kind of highlight the crisis response. I know we've had some conversations in the past about having dedicated mental health professionals ride along with, whether it's BPD, Whatcom County Sheriff's deputies, and I think there's benefit to that. I know there was some concern with the change in legislation, that what would that look like now that there's a little there's obviously a change in response. We obviously still respond to mental health calls, but it's going to require a lot more time and additional resources. And like I said, we've, number one is the lack of the resources. And that's what we're finding out in the field is trying to, we had a perfect example the other day. We had somebody obviously in mental health crisis. We called MCOT, and, we took a lot of time and used our crisis negotiators, and they never actually made it out to the scene. Thankfully, we were able to get her to cooperate with us and safely get her the help that she needs. But, that just highlights how hard it is to get alternative resources out into the field in a timely manner to deal with these things, because they're happening now. A lot of times, they're rapidly evolving, and in 3-4 hours, that's not adequate. You need people in a timely manner. So having people in the field riding with law enforcement puts them on the scene immediately, and law enforcement can step back and let people trained in mental health do their job. So I would like to continue moving forward. If there's grant funding for that, certainly would advocate for that within the sheriff's office.
And we, Doug, we have put in the request for those funds for Whatcom County. And so I think it's just a matter of getting them to us and then getting someone hired.
Stephen?
I know it's not sexy, and that's why it's pretty far down the list, but one of the core charges to the task force is to be evaluating the effectiveness of programs. So that item M, data and program review, I really have no idea what data is out there or how program effectiveness is reviewed, but it seems like we ought to be doing some of that in this committee. And other than that really superficial comment, I don't have more to say about that.
Okay, so I'm pretty reliant on the index committee when it comes to the data pieces, and maybe I am over reliant on them to come up with their recommendations. And I don't know, I guess maybe we need to dig into some of these pieces when it comes to behavioral health specific items. So I hear you loud and clear. I'll circle back with Mike Parker and try to address that. I'm wondering if any.
If I could just say, Dan, my point was going to behavioral health and SUD programs. I don't think we'll get anything out of index necessarily in that respect. It's sort of beyond their responsibility. I was thinking in terms of weighing programs or looking at other models or evaluating what we're doing. I think we're, and I may be wrong, but I think we're flying relatively blind in our own domain.
Okay, fair enough.
And
Go
excuse
ahead,
me,
Ann.
I think, so I don't know that we're flying blind, but perhaps we haven't shared with the task force as much as we should. So any program that the county funds has performance measures and outcome measures, and we collect those on a regular basis. And so maybe we should set up some kind of a reporting system to make sure that what we do know gets to this committee and to the task force.
Actually, that's exactly the response I was hoping to pry out of this comment. I thought there was something somewhere, and so yeah, I would welcome whatever you can distribute.
Perry, go ahead.
We jumped to an important topic, obviously, with Stephen was sharing, and I wanted to reiterate something that Doug had said, mostly because it's sort of my own sort of pulling in information and being in meetings and so forth. I think it's really helpful, Doug, the point that you were making in terms of being in support of mental health professional or an entity being able to be with the deputies, et cetera. And I think that that's something that needs to continue to be verbalized in the various meetings, not trying to tell you what to do as much as getting that message out there, because I'm not sure that that is an information that even the mental health professionals or sort of the general folks out there have. And I wholly agree with you, Doug. I think it's really important for immediate response. MCOT's great. They're overwhelmed, as you know. But I think that's something that really needs to be brought up to the surface and talked about pretty significantly at this point in time, because I think that if you polled mental health professionals, they'd say, nope, sheriff's office or BPD, they want nothing to do with this because of legislation, et cetera, et cetera. So just wanted to make that point, Dan. Thanks.
Before we switch over to the ARPA discussion, I want to provide providers a moment to chime in if they want to. I see Michael Smith is on the call from Lake Whatcom. I don't know if you're with us here, but if you wanted to chime in, and any other providers that are with us today to just give us their view from the field.
Yes, I've been listening off and on. We kind of have a crisis. I'm at an inpatient center here. So it's funny, the topics that we're talking about. I mean, I have a guy laying out in my driveway right now in crisis. And, he just left base camp. There's like 35 new cases there. So base camp is closed. He's trying to get into the crisis triage. Crisis triage won't take him. And so he's a part of PAC. So we have the PAC team on the way to come get him. But like, there's nothing to do. There's nowhere to send him. And I'm sure a lot of folks in our community are just out there in these same situations to where they don't meet that level of care to actually be brought into the crisis triage. Excuse me. And they're just kind of in this limbo position where they need help, but they can't get the help that they need because they're not at a high level of care. They can't be detained, but I mean, they're in crisis. They can't, they have an anxiety. They're having symptoms to be able to go to crisis triage, but we know for sure that this individual tried to go last night. He just showed up last night in the driveway. We can't take him. We're substance abuse, serious mental illness, inpatient center. We need a referral. He needs a lab COVID test. I mean, there's so many things that are in place that are barriers to individuals receiving this treatment. It's ridiculous, but it's needed, right? I mean, we need a lab COVID test. Individual tested negative in a lab COVID test and was, around someone with COVID, and then 7 days later they tested positive. And so the COVID tests aren't even reliable to help get these individuals in these facilities right now. So COVID is definitely impacting the availability of the services in the community. That's just what I see.
Thanks for providing that update, Michael. Appreciate it.
Yeah.
Dan,
Go ahead.
can I just offer to Michael to connect with me or Perry after this meeting? Because I think some of what you said doesn't make sense to us and we'd like to help.
Okay. Yeah, Michael, if you can connect with Ann or Perry, that'd be great.
Sounds good.
Okay. Yeah, maybe we can come up with some solutions here. All right. So it's 9:35-ish, and I want to move on to the what was item 2 in the agenda. Thanks for getting us back here, Jill, so we can all see each other. And Heather Flaherty has joined us. And Heather, I'm wondering if you can just guide us through here.
Yeah, thanks for waiting for me to have this conversation. You all probably recall that Tyler Schroeder, he's deputy executive, right, of Whatcom County, came to the task force to say, hey, we have these ARPA dollars coming and we'd like to check in with our task forces and our advisory bodies on priorities, help us be informed in our recommendations. And the Behavioral Health Committee, our committee, said, okay, let's take this opportunity and answer the question. So a few of us got together and looked at some of the priorities that we've been talking about and really tried to focus on the ones that have been directly impacted or exacerbated by COVID. So we crafted this letter. The hope and goal of this letter, we brought it to the committee last month, and there was general support. We said, if you have any specific feedback or details you want to add, please do so. A few people took us up on that, so there's some minor edits. But generally, it seemed like there was support from this committee for these top 4 priority areas of funding as it relates to COVID impacts. We know that the needs are endless, right? And there's so many things that should be on this list. But the top 4 that came to us were the behavioral health workforce, investing in that, pretrial and reentry support, 24/7 mental health emergency center, and supported and transitional housing. So the hope is that we can look at this letter again today as a committee. If there's anything, I can walk through the details too of it. I would love it if the committee feels excited about this, that you would recommend sending this to the task force for approval and signature from the task force to go back to the county executive's office from us as a body. Chair Dan Hamill, is that the right kind of procedure that you would be hoping for too?
Correct. So I wanted to make sure that this committee, that it goes through a process that goes to subcommittee first before it goes to the task force, so that it's vetted and that everyone on the committee had an opportunity to chime in and provide feedback, make adjustments, and then if it pleases the committee, this body, then we move it forward. So I don't know if folks have opinions on it, but this is the time to talk about it.
So if it's helpful, I can scroll through each section of the letter just so you have a good recollection of what it's saying, and then we can discuss as we go. And
go ahead and take us through it, Heather.
Okay. I think, Jill, are you able to put it up for us?
Yes, I can do that. I also just gave you co-host ability, so you can share as well.
Great.
Either one.
There we go. Thank you so much. Okay. Let me get situated here. So this would change. Right now, this letter is to the subcommittee and the task. Well, maybe it wouldn't change, but anyway, the audience was us, the task force, and then hopefully Whatcom County Council and the county executive's office. We were asked to develop recommendations for ARPA investments. We recognize the landscape for these decisions is complex, and we want to share our perspective on some of the issues that continue to come up as barriers or gaps in services. The following are 4 priority areas that we support broad investment in through the use of ARPA dollars in addition to other resources. So we list those out and we say additional details below. Bringing it back to the goal of the task force at large is to prevent and reduce incarceration. And we do that by bringing leaders from across the sectors needed to work together to build systems to achieve that goal. Our subcommittee in particular looks at building up the system of diversion and treatment to assist with the complex overlap of behavioral health issues within the criminal justice system. We see how untreated behavioral health issues and trauma can lead to someone's involvement with the legal system, and if left untreated, can lead to cycles of recidivism. We also recognize these are one-time funds, one-time opportunities to make investments in creating systems of care. And we also are saying we support the government's desire to use ARPA sustainably as startup funds, capital dollars, or catalytic investments in programs that can build sustainability over time.
Heather, This is Anne. Just a typo in that last paragraph. House Bill 1406 is the correct number, not 1407.
Okay, thank you. We'll get that changed. let me make a note. So then we go into each of the priority areas and we lay out what the problem is and what some opportunities are that we see. And I look at this as an opportunity for us to be a voice, a credible voice of advocacy in helping the executive shape their priorities. Do I look at this and think we're going to get everything we ask for? Definitely not. But I think it's actually really helpful to have layers of support and voices saying the same kinds of things. And I hope we can be an avenue for that. So there's the problem. We all know this problem by heart at this point, that there's a real workforce shortage. People are not going into this field. This will probably be a generation to really solve this, right? There needs to be some long-term strategies, but in the short term, we saw some opportunities of evaluating the possibility of hiring and retention bonuses, supporting workforce bridge strategies such as apprenticeships for lay people with proper supervision, tuition assistance, ensuring programs have the depth and breadth of clinicians to maintain favorable staff to patient ratios and quality outcomes, advocate for strategies to increase industry salaries, provide relocation support, and invest in organizations working on long-term strategies, develop those relationships and partnerships to advance this goal. I also want to just say really transparently, I recognize that government also is not always designed to actually seize these kinds of opportunities. These may be a little more entrepreneurial in practice, but I think it's not our job to say, no, they can't do it. It's their job to tell us, no, they can't do it. I think we should still ask for and dream the solutions and see what's possible. And if a government can't do it, that's a really good thing for us to know, because these things may be community-based opportunities then that we can shift to seeing where can we do this elsewhere.
Committee questions at this point?
Okay.
Seeing none, go ahead, Heather.
Thank you. The next priority is pretrial and reentry support. We talked a little bit about the problem, about how COVID-19 has really stalled the processing of individuals through the system, but it's also demonstrated some progress in incarceration reduction through putting constraints on jail bookings. There's an opportunity here to set people up for success during the extremely vulnerable times of pretrial and reentry. And so ensuring that these services are robustly staffed and provided enhanced training can help people from recidivating or having to enter the jail at all. So some opportunities we see potentially for ARPA dollars would be investing in the staffing and capacity around pretrial and reentry services, providing those trainings about being trauma-informed, the best practices and evidence-based approaches, diversity, equity, and inclusion trainings for our probation, pretrial, law enforcement, and reentry specialists, and then hiring navigators or case managers whose role could be to specifically support individuals through all aspects of the criminal justice system, from arrest to reentry, with the mindset of reentry from the very beginning.
Committee, any questions on pretrial? Okay, go ahead, Heather.
The next dream is the 24/7 mental health emergency center. And I wish Arlene was here, because she knows this dream, all the details of this dream. But we talked about how legislative reforms have made some impacts on our law enforcement's ability to respond to calls and provide support. We haven't scaled up our treatment and diversion systems. They need investments. We're hearing story after story about that. We need places for people to go and for mental health professionals to refer to. And so the opportunity here is, let's use ARPA dollars to build that mental health emergency center. And this would be open to the public. Anyone who's in crisis could access and be given care, treatment, support, and referrals. This would be different than the Crisis Stabilization Center in that services would be broader and accessible. And it would be, I think that Everett has this model at Providence, where there's a special emergency room just for, or urgent care, just for behavioral health. And it helps divert people out of the emergency room, but it's less arduous to get into than the Crisis Stabilization Center, for example. I see Anne's hand raised.
Yes, I would take out the example of the Crisis Solutions Center. I know it well, and it is not a mental health. It is our Crisis Stabilization Center, and that's how they operate. And I guess the only other thing I would say here is that there used to be peer support centers like the Rainbow Center. And I think there's still one, Consumer Voices Are Born in Skagit County, perhaps. And those are not 24/7, but they are drop-in centers. But I guess I would just caution us to do a lot more research on this. I'm feeling somewhat uncomfortable recommending this because I think there is some, I just think there's some research out there that would say perhaps this isn't the best way. It becomes a drop-in center for anyone and everyone. It's very hard, and then you don't want to turn people away. It's just a really, really highly sophisticated program challenge. I don't know how else to say it. I think in an ideal world, it'd be fabulous, but I do think there's concerns. I do like the model better of an urgent care facility where might be connected to a hospital system. I think that would be probably the easiest to implement. If I made any sense at all. That's kind of babbling there.
You made a lot of sense, and I took all the notes of what you just said, Anne, and I will make some changes to that section and send it back out to the committee. One thing too that we can do is add the word explore using ARPA dollars to support whether it's a behavioral health urgent care or some sort of center to support those people that Michael just mentioned that are falling through the cracks of where can they go for help.
Other questions on this piece? All right, seeing none, go ahead, Heather.
Great. And then the last priority that we went into is the supported and transitional housing. The problem that we were talking about is that there are some supported housing programs for individuals who need additional case management as they're working through mental health or substance use disorders, but there's not really a continuum of support that exists. So when individuals graduate from these programs, they're often left without help or resource at a vulnerable time. So some opportunities are invest in and develop a continuum of supported housing, including recovery-oriented step-down programs. Big dreams, right? Use ARPA dollars to acquire properties like the newly established recovery house designated for reentry support or graduated supports. This also helps remove that barrier of people with a criminal record that landlords may not be willing to rent to. And then build in a spectrum of programming that meets people where they physically are with access to supports, therapies, and job training.
Okay, committee questions on that piece? Okay, I see no raised hands. I've got a ton of questions on all of these pieces. What is the tranche, the first one? Are they're duplicative, they're the same amount. What is the county getting for the first load of money here? Do we know that?
Are you talking about ARPA?
Yeah, ARPA.
22 million.
22, and then it's 22 next year. These funds have to be spent and within 3 years. So I like all of these pieces. I have questions about the mental health facility, the hospital piece, and I share Anne's concerns to some degree, but one of my concerns is BA waves, and I just don't know. I guess I'm not understanding how the investments in ongoing operations. So the first dollars that would be associated with any of these programs would create a bow wave going into the future. And what I mean by that is that you're creating like this kind of long-term ongoing program, and where do the dollars come from to help fund the program after the ARPA funds are extinguished? Is it $1,590, $1,406? Is it are we going, is the county going to go to the voters? What is your vision on that? How does that work?
That's a really good question, Dan. And I guess I see our role as a committee and task force is to share the ideas, because we've been close to the issues. And I see the county government role as, let's figure out how we do this. And in the beginning, we framed this letter saying, we know these are one-time funds, and we know you want to invest this in one-time uses, including, I think I'm calling it a catalytic investment in programs that could put them in a place where they have future support, whether that's from county government dollars or from federal grants. And I don't think it's realistic to think that all of these programs would be invested in and create a giant bow wave. But if this can get into Stat Paul's thinking about how we can be slicing some part of ARPA for behavioral health, and here's a whole menu of, pick any and it'll be helpful. So I don't know. I don't know what the right answer is for sustainability for some of these program things, but I also don't think that should stop us from taking a step and trying it and maybe designing it as a pilot.
Okay. I don't want this to be the Heather and Dan show necessarily from back and forth discussion, but I do want to commend you for coming up with these ideas and working on this. This is a step in the right direction. I just want to make sure it's sustainable. And then my other question would be on your bricks and mortar, when you're talking about building a mental health facility, if there was any consideration given to outside leveraging the home fund and subsequent $1,590, which brings the total to $7 million within the city of Bellingham per year, can leverage up to 10 times and in some cases up to 12 times on capital investments. And I'm just wondering if you had thought about what that outside leveraging capacity might look like in your thinking.
Absolutely. Yes, let's leverage. And I wonder too, Dan, later in the letter, I think we say, so just to finish this, we have additional priorities that broadly, generally, we think the council and government should be thinking about. And we said we express support for investments that support child and family success, youth mental health supports, and also the importance of investing in data where possible. ARPA funds could potentially be used to build infrastructure, connectivity between databases and systems. We end the letter by saying, we're here to support the how, and how there's 1,000 ways that you can implement and get to the how we do things. So we offer our support and partnership in advancing this vision and are at the ready to serve and support the development and implementation of these strategies, including funding. So if that means at this point, I don't know if we want to make the effort to put in the sheet of here's how you can do this, council. Here's all of the paths to sustainable funding, when we don't even know where their energy and appetite is for picking anything off this menu. So, how fully baked do you want to bring solutions to when we're just in idea phase and advocacy phase?
Heather, can you take the screen share down so we can see each other? I want to have a discussion on this. Thank you. All right, committee, this is the time to talk about this. We're talking about making a recommendation, not just to the broader task force, but ultimately to the county council. I serve on Bellingham City Council, not the county council. So this is outside my purview. I would, in theory, support these things with some vetting at the city level, but I don't have jurisdiction in the county. So I want to hear from committee members' opinions on, moving all or some of these items forward for recommendation, or if you want to sit on this and consider it, or if you want to have this as an agenda item for legal and justice to talk about for the shared committee next month, so we can get more opinions on this. So I'm here to listen to folks and their feedback. Under Sheriff.
I think all in all, it's a good list of recommendations. I share the same concerns about when you have dollars that are only going to be provided for several years, investing in staffing, and then what do? You stand up a great facility and you've got the staffing, and then all of a sudden you have to cut back services once the community gets to know those services and rely on those services. So I would be more supportive of looking more at properties and investing in the future of behavioral health, whether that's scholarships or investing in education to bring more people. There's going to be an ongoing need. I don't envision that there's going to be less need as we go forward in the years to come. So I know it's a long-term investment, but I think if you've got limited dollars, you can offer those now and hopefully get those people into those programs. And in 5 to 10 years, you've got a robust pool of candidates to fill those positions for the future. And then my only other, and I appreciate under the additional priorities, but trying to maybe in each one of these 4 categories, just highlighting the lack of resources for youth, young adults when it comes to mental health and substance use disorder.
Stephen, I saw that you unmuted. Do you have some comments?
Yeah, first of all, I would endorse your suggestion, Dan, that we consider taking this to the joint meeting. I think all of these ideas, maybe the least of which is the still in flux mental health crisis solutions center, whatever we want to call it. But all of these are great ideas. And I look at this, and Heather, tell me if I'm mistaking it, as sort of dropping some bait in the water to see what piques the interest of the council. But I don't think we should be sending him a couple of things from different perspectives in the task force. So if to the extent we could coordinate this with legal and justice, which I suspect will have some intra-system kinds of ideas also, that would be better.
Anne, go ahead.
I would love to work more on these ideas to try to identify some one-time investments that could be made that don't necessarily require ongoing support. And I think it takes a little bit more thought on my part. And I'm sorry, I don't have something to offer just off the top of my head. But I think that if I just speak from as a government employee, I think government would be more receptive if they saw one-time opportunities that didn't behold them to long-term contribution. And so I just think we could, maybe with more committees taking a look, and I certainly am willing to take more of a look as well. I think the 4 priority areas are absolutely right on. And I would love to just give a little bit more one-time investment information and recommendations to the county.
Michael, go ahead.
Just to kind of speak to the ongoing financial support to one of the suggestions that Heather brought to the team was the model of white feather reentry. I know that organization or did know that organization. Well, they changed their name to Zoe House. I had to look them up. I know the owner, Lester Rogers, down there. She sort of has a host of recovery houses that sort of work like the GRACE program. A lot of individuals or case managers from the community organizations, they come into those homes. So all the management, the case management, all the support, the staff support is from community agencies. So they come in and it's productivity for the organizations in the community. They're able to, maintain, the management of those clients. So there's no real financial support needed. The only thing that would really need to happen is purchasing the homes or renting them out in leases and just kind of seeing how that works. So there's a few ways that she works her model. She leased some, she bought some buildings, but the continued work that's being done is being done by the community agencies. And those are the policies, those are, the lease that they signed to be in the home, they agree to that. And if they don't agree to that, then they can't live in those homes. So it's sort of self-sustainable in a way where no dollars really have to come out of her pocket, or she has to actually staff those homes. They're being staffed by the community agencies.
Thanks, Michael. Stephen?
I like Ann's idea of doing some more work to identify the valuable upfront one-time investments. I'm sensitive to the bow wave issue. At the same time, this is an opportunity to pilot some things we know are needed. And I think, in a couple of years, they should be showing benefit. They should be preventing and reducing incarceration. They should be justifying themselves. And if not, then we've learned something there with a one-time opportunity to experiment. So I don't think we should be completely stymied by doing things that have promise that we might be able to demonstrate the value of, and have them self-justify in the eyes of the council going forward a few years out.
Michael, did you have further comments that you wanted to add? You got your hand still up. Okay. Okay. Does anyone have what's the timeline on this in terms of decision making on ARPA funds? Do we have time to go to the joint committee meeting and have this discussion further, or are we on a timeline here? Andy, or Perry?
I think there is time. I was out last week, but I believe Sat Paul provided his overarching strategies to the county council last week. And he looked at, if you will, buckets or areas of focus, categories of focus for ARPA funds. But I think, the devil is always in the details. And so I think this is a great place to get a little bit more specific and more helpful to the county. And I think they're not going to roll everything out at once anyway, because that's just too heavy of a lift. So I think there's time, and I think it would be great to get more input and give some of us more time to look at it.
Okay. I guess I'm going to ask Brian for his thoughts here in a minute, but I want to chime in here as a city representative. We've also got funds that are ARPA based, and we have 1590 passed at both the city and county level. And I want to understand what the nexus is between the city and county funding. If we can, can we be stronger if we do things together, and just what that looks like. And then I just wanted to ask Brian if you have any thoughts on the housing piece, if you're seeing any kind of emerging priorities or things that you'd like to address.
Thinking of a one-time upfront investment, we have talked in the past in various forums about we could potentially better utilize or more fully utilize the Housing Authority Shelter Plus Care program if we acquired some dedicated units.
Okay.
Need more conversation about just what that would look like. And
okay. So it seems to me that we should take this. This is Heather, great work, by the way, on this. This is outstanding. I think we just need to take it further and have Legal and Justice chime in on it in the joint meeting. I'm hopeful that all of us are able to make that meeting next month, so we have the kind of the basis and foundation of understanding what these 4 items are. So Heather, do you have what you need in terms of feedback to do any updates or any further revisions before this goes to the joint committee?
I am not sure. I have Anne's feedback about how we can wordsmith and shape the emergency room part of the letter. But I'm not in a position to put in, here's how you can do all these things. And I'm not sure if that's what you're asking for before we present it to council. So if anyone else wants to take it from here, I'm happy to just send you the Word document.
Are there committee members that want to chime in and work on this? Heather, you might be on your, you might be the lead on this one again. I think that there's got to be some options on the how, without being prescriptive. I think just opportunities on how to move forward. The bow wave consideration is problematic to me, just knowing how electeds think if they don't see a pathway forward for long term. It might prevent that from any bow wave activities. And what I'm thinking of is, of course, the workforce issue. That is the perennial discussion topic. It seems like it's coming forward every single meeting that we get together. So I would want to understand, utilizing $15, $90, 40% of those dollars need to go to mental health, and the rest go to housing. So I think that there's an opportunity there, perhaps. 1406 is $700,000 a year. That I don't know if that could be worked into the equation. I don't see county council necessarily raising taxes to help fund these ideas, but that could be a possibility. Unlikely in my opinion, but I would want to have a how, Heather. I think that's how we move forward. So perhaps you and I can discuss offline what that could look like. Are you open to that?
Sure.
Okay. I just want to generate some, if we can't get to a how conclusion, then we just have these like concepts, I guess, out there.
Yeah, I just want to say though that there's an element of these decisions are happening. Sat Paul already made some recommendations last week about ARPA dollars. And I just feel this, like, I don't want perfect to be the enemy of good. I think there is an opportunity to just say, these are issues that are important. In case you didn't know, we want to lend our voice. Next chapter is how, and how we do all of these things and how we implement that. That's the next letter. And so, I just don't want this letter to die by committee.
Okay. I get you. All right, let's so it's 10:10 right now. Go ahead, Ann Deacon.
Just one brief. So I think your point is well taken, Heather, in the sense that you need to plant some seeds now. And I would agree with that. And I also think that if you don't provide something they can hook into ASAP, it does tend to go away. And so I see the importance of both. And I'm certainly willing to talk with staff about, some ideas on how we can plant a few hooks in here. But I also agree that, it is important for the county council and I think Sat Paul's already aware of this, but I think it's important for council to understand what some of the main drivers of concerns are right now.
Thanks, Ann.
And Ann or Heather, in your opinion, are these items in alignment with the executive's thought process? when what he presented to the county council last week?
I didn't hear his presentation, so I don't think I want to comment on that.
Okay, fair enough. All right. Heather, let's you and I discuss this a little bit further offline, then bring it back to the joint committee next month. Does that sound fair to you?
That does sound fair. The timeline, I think, just is that before the next task force meeting, that law and justice one?
Jill Nixon, do you know what the?
Yes, it is.
My hope would be that we could bring a draft to the next task force meeting and seek a vote for endorsement of the letter in full.
Okay.
So that then we could take it to law and justice first and get edits and input, and then if we're still feeling good about it, take it to the task force.
Okay, good. I share your sense of urgency on this and trying to get priorities, more nailed down. So I get it. Okay, anything further on this item?
Yeah, in terms of going to the joint meeting, I think there needs to be some advanced pump priming there. So I think this ought to get out to Raylene and Arlene, get distributed to community members with a concise but fairly substantive description of what we want them to be doing with this, so that they're coming in with as much forethought as possible and they're not starting from zero.
Agreed. Completely. Jill Nixon, you came on.
I was just going to give you all an update on the status of the joint meeting agenda when you're ready to discuss that.
Okay. All right. Anything further to this item? Okay. Seeing none, I don't have the agenda in front of me, so I don't know what's next, but is the joint meeting the next item?
Yes, it is.
Okay.
And from the last Legal and Justice Committee meeting, the only item that they included on the agenda for the joint meeting in September is domestic violence offender treatment, which is a topic they've been working on. The steering committee is also asking all the committees to brainstorm and come up with some task force communication messages to identify targeted messages to the community about certain task force initiatives. And then from today's discussion, I have juvenile SUD, the ARPA letter, and I'm also wondering if you want to include the discussion about behavioral health treatment provider right along with law enforcement.
How long is that joint meeting?
90 minutes.
Okay, great. Excellent. All right, I don't know. I'd like to get co-chair Parker's input on this, and also if you have input, that's a packed agenda. Is legal and justice and behavioral health now 4 times a year, or is it still 2?
4 times a year. The joint meeting is now 4 times a year. And I can remove that communications item or leave it at the bottom of the agenda with a tentative note in case it doesn't come up.
I'd put it at the bottom of the agenda, and if we can get to it, we can get to it. Otherwise, committee, this is basically the steering is trying to do its best to communicate outward facing to the public on the work that's being done. This, if you'll look at your screen here, there are 3 people in attendance. One of them is the policy analyst for the city of Bellingham, and the other are a county employee, and I don't know who the third person is. These meetings are basically invisible to the public. They don't know what we're doing and the work that is going on. And the idea is that we need to better communicate to our citizenry so they know what the work being done is. And so I think that what I'd like to do is put that at the bottom of the agenda for the joint meeting. If we don't get to it, bring that up as one of the first items in the subsequent behavioral health committee meeting so that we can have that discussion. I think that that's important But as far as the joint meeting, I just think there's too much work to be done. And I really do want to prioritize, Mr. Cochran, your presentation on juvenile SUD. And I think that that's an ongoing discussion because it influences the work that we're doing. All right, so Jill, what other items do we have? Sorry, first committee, are there any other inputs on joint committee agenda items? Okay, seeing none. Jill, what's the next item?
The next item is other business.
Okay, any other business before this committee? We're at 10:17. We might actually get out of here a little bit early today. No other business. Is there, and then this is the last item, public comment?
That's correct. If anyone who's attending today would like to speak to the committee, please virtually raise your hands now by selecting the raise hand icon. And we have Mark Gardner. Go ahead, Mark, and activate your.
Hello, can you hear me?
Yes.
Just one quick sentence about the ARPA funds. It's not quite as dire as might be seen in terms of the timeline, because the funds have to be obligated by December 31st, 2024, but they can be expended through the end of 2026. So it provides just a tiny bit more wiggle room. Doesn't end the cliff problem, but there's plenty of time to be deliberate about this. So it's good. It's more free and unrestricted than prior COVID relief funds have been.
Thanks, Mark, for that update. It's extending the cliff is always a good thing, I guess. All right. Any other comments from the committee? Okay. Seeing none, I guess we are adjourned. Thanks for being here today. Have a good day.